The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Welcome to Pain Free Today with your host, Denis Thompson. Brought to you by Worldwide Advanced Medical Technologies, LLC. Call 954-256-0045 or online at painmanagementnetwork.com. Here you will learn how to eliminate your pain. You will learn about a revolutionary new therapy called the ARP Wave System, which treats the neurological origin of pain, not the symptoms. You will learn how to increase your range of motion and how you can move freely without pain at any age. You will learn how you can try one free treatment from one of our local providers. Denis Thompson has 25 years' experience working with top athletes and non-athletes of all types. He has treated thousands of patients with better than a 95% success rate. His list of athlete clients reads like a who's who of the sports world. Listen and find out how the ARP Wave System can benefit you. And now, here's your host, Denis Thompson.
Good morning and welcome back to Pain Free Today. This is our second show of many to come. When we left off last week, we were talking about the ARP Wave System and how the treatment process actually works. But before we get back into that, for our new listeners today, I'd like to explain the reason we're having this show is to reach out to providers, doctors in the area, because we are looking for doctors to treat patients who are interested in utilizing our system. And we're looking for anyone who is living in pain, has restricted range of motion, has been told they need surgery or has had surgery and just hasn't gotten the results that they really, really wanted. So with that in mind, we are offering a very, very unique new opportunity for all of you to experience what we call the ARP Wave System. And people say to me all the time, well, what is the ARP Wave System? Well, the ARP Wave System is just that. It is a system of therapy, and it has three separate components. And it's all built around a very, very simple premise that anywhere you have pain, anywhere an X-ray shows you have a problem, anywhere an MRI shows you have a problem, is really where the problem ended up. It is not where the problem is coming from. So the ARP Wave System basically will identify exactly where the neurological origin of your physical symptoms is emanating from. Once we can find where the origin of the signal is, then we can pretty much eliminate the symptoms of pain. So again, wherever you have pain is where the problem ended, not where it's coming from. Now, all of the providers that you've seen are extremely skilled, extremely gifted, and very knowledgeable. But however, they're trained in physical medicine. In other words, where it hurts. Physical therapy works on where it hurts. Medicine works on where it hurts. No one, and I mean no one, is working on where it is coming from. So the ARP Wave System is a system rooted in science and rooted in a very simple fact that all issues, whether it be pain or disease, come from a neurological origin, since our nervous system drives everything in our body. So the ARP Wave System, basically the first step in the system is find out, is the nervous system sending the right signal to the muscles in your body to where the muscles in your body can act as shock absorbers and absorb force coming into your body? Because that's the first step. If your muscles are not absorbing force, that force is going to go to tissue not designed to absorb force. So many people will come to us and they'll say, well, you know, I've been diagnosed with carpal tunnel, I've been diagnosed with joint problems, and I've been diagnosed with this. Anytime you're dealing with a joint problem, you're dealing with a muscle problem, not a joint problem. The muscle's job is to support the joint, not vice versa. So if that muscle isn't supporting the joint, then all the force is going to go to the joint. You're definitely going to have pain and a problem. So the first step in the ARP Wave system is designed to find where the origin of the signal causing the pain is coming from. And we do that with a very, very simple test. And we have to find out, is your nervous system working correctly or not with this test? So what we're going to do is we're going to test your muscles to see if they can absorb force. Not to test your muscles to see how strong you are. We're going to test your muscles to see if they can absorb force. It's a very simple test, and most people do not know this, and certainly most providers aren't aware of this, that the muscles are the outward expression of the nervous system. So by testing the muscles' ability to absorb force, what in essence we're doing is testing the nervous system's ability, or lack thereof, of sending the proper signal to that muscle to act as a shock absorber. So the test takes about 5 to 10 minutes, and we will basically test every muscle in your body to see, can you absorb force or not. Now, you could be the strongest person in the world or the weakest person in the world. It makes no difference. If you cannot absorb force, you eventually are going to have a problem, or if you don't already have a problem. So the first step in the system is identifying, is the nervous system working correctly? The second step is to find out all of the damage caused by the nervous system not allowing the muscles to do what they're supposed to do. So in other words, fix the damage caused by the shock absorbers not working. So we talked last week about analogies, and we used the analogy of an automobile. If you take the shocks off of an automobile, the force goes to the frame. Well, the muscles in your body are your shock absorbers, and if they are not working, the force is going to go to your frame. Guess what that might be? Oh, that would be your skeletal system and your joints. So it's real simple when we look at it in simplistic terms and when we use simple analogies. So since your muscles haven't been working correctly and acting as shock absorbers, does it not make sense that there might be some damage caused by that not working correctly? And of course the answer is yes. So in the second step of our system, we identify exactly where that damage is. Now, for the providers listening, how we do that is an extremely effective mechanism that you can, as a provider, use to identify exactly where the cellular disruption is. And the way you do that is scar tissue is piezoelectric, and it is charged electrical collagen. So when we utilize our proprietary tool called the ARP Wave, and we are scanning the body with that wave, when we run into an area that is walled off by scar tissue where there's basically no cellular communication going on, for all intents and purposes it's a dormant site, then the tissue is going to immediately react to the current coming in, and we're going to know immediately where that spot and origin of electrical disconnect is. Because we all know that whenever we have scar tissue walling off tissue is where we have an electrical disconnect, because we have sodium, potassium breakage, et cetera, or leakage, I'm sorry. So what we're looking for is that electrical disconnect. Once we find that electrical disconnect, we now know where the signal's coming from to the muscle that didn't do its job to support that activity. So now we anchor an electrode at that location, and we take another electrode and we move it around the body until we find a secondary source. Again, more scar tissue. Once we find the beginning and the end of that trail, we now start to work on those areas that we have identified. So providers, this is the most efficient way for you to determine exactly where to treat a patient. No more guesswork, no more needing of expensive imaging. This will immediately tell you exactly where to treat. However, there's going to be a dilemma there because it's going to be nowhere near where an MRI shows the problem is. And again, keep in mind the MRI is showing us where the problem ended, not where it's coming from. So all of you out there who are suffering from pain, all of you out there who have restricted range of motion, your issue is not what you think it is. Granted, your issue is where you feel it, but that's where the issue ended up, not where it's coming from. So in the first step, we find out, is the nervous system working correctly? In the second step, we begin to treat the areas that are causing the problem, not the problem area. And in the third step of our system, we have to build up your body's ability to absorb force, because without that ability, you're going to end up right back where you were before, having pain, restricted range of motion, et cetera, et cetera. So that kind of in a nutshell is what the ARP Wave System is. Again, it's a three-part system, and if one of those pieces is not done correctly, the system does not work. Now, the interesting thing about the system is it's 100% predictable if you follow all three steps. If you choose not to follow one of those steps, it becomes just like anything else, totally unpredictable. But not many things in medicine are 100% predictable. This system is, simply because we're working on the origin, not the symptoms. So with that in mind, we've had a lot of questions from last week's show. I was flabbergasted at the amount of mail that we received. And if you would like to ask a question for next week's show, just simply go on your web to www.painmanagementnetwork.com, all one word, and just submit a question. The first question that we had that I thought was quite interesting is, what is the ARP Wave philosophy of joint replacement surgery or fusion surgery? So this person is basically, in reading their email, has already had joint replacement surgery. They had a total hip replaced. And it's now been, looking at the email here, it's now been about 9 months since surgery. They still have symptoms. They still have restricted range of motion. Their activity ratio has not gotten back to where they would like it to be. And their question is, what is our philosophy on joint replacement surgery? And the answer to that question is this. If you have had surgery for joint replacement, you have had surgery to replace a broken part. You have done absolutely nothing to prevent having another broken part. That's why many doctors will tell you after joint replacement surgery that, and you know, the technology is getting much better now, but 5 to 10 years ago they would say, okay, if we're going to put in an artificial joint, you know, we're going to have to put another one in about 10 to 15 years. Well, now it's up to around 20 to 25 years because the materials that we use are much better. However, the problem still hasn't been solved. And if it had been solved, you wouldn't need to put in a new joint after your first one. So what is the problem? Why did you need a joint replaced? Well, the answer is simple, but it's also never been addressed. The only thing that's been addressed is you needed a new joint. And since you have a new joint, you should have better range of motion, et cetera, when in reality you've done absolutely nothing for the problem. And the problem is that your muscles around the joint have not been neurologically firing to where the muscle acts as a shock absorber. So all of that force coming into your body. So hypothetically, if you weigh 200 pounds, you got about 600 pounds of force coming into your hip every single step. So all of that force coming into your body should be coming into your shock absorbers. In your case, if you had joint replacement surgery, it's going into your joint, which it's not supposed to do. Now, just common sense says that if all that force just keeps building up and building up and building up, you're going to wear that joint out pretty quickly. And that's really why we have joint replacement surgery need, is because we've worn out that joint. We've displaced that joint. So what our philosophy is after surgery, and that's what we're talking about now, we need to work on the muscles that should be supporting that joint, get them neurologically firing correctly, and no amount of physical therapy is going to do that because it is an electrical signal that's been disrupted. And until you eliminate that electrically disconnected signal, you're going to have the same end result, which is the muscles are not absorbing the force, so the force goes to the joint. Henceforth, you have joint damage and a need to get it replaced. So the answer is very simple. If your body isn't absorbing force, the force is going to go someplace it's not designed to go. So I can hear our tones in the background here, and we'll be back in just a moment.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website www.painmanagementnetwork.com and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com, and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
Welcome back. Well, hopefully the first few minutes have been instrumental in answering the question, what is the ARP Wave System and how can it help me? So no matter what condition you're suffering from, that condition has a neurological origin. And since it has a neurological origin, in most cases, the ARP Wave System can be extraordinarily beneficial. Now, the therapy is done in addition to everything you're presently doing. So it doesn't replace anything. It just adds a different side of the coin. There are two sides to that coin. There is a physiological side, and there is a neurological side. We are specialists in the neurological side of that coin. So I have another question here that came in that was quite intriguing to me. And this client has had basically a chronic pain for over 20 years. And what they're asking is, how can the ARP Wave System help with a condition called RSD, which is now normally called CRPS. which is one of the most debilitating chronic pain diseases there is. And the only thing basically that the patient usually can do is take large doses of heavy narcotic medication just to kind of stem off the feeling of pain. So the answer to the question is, what can the ARP Wave system do for RSD? Well, we've been extraordinarily successful in treating many patients of many doctors throughout the world with RSD, or as I said now, it's called CRPS. And I think there's a simple reason why. First off, I believe that, and this is strictly my belief only, no one else, I do not have a scientific study to back up this belief, but I always ask myself, what if? So when we're dealing with chronic pain, traditionally things like fibromyalgia or things like CRPS, they're all diagnosed extraordinarily efficiently, and the premise of the diagnoses is that the nerves are overexcited. So the treatment is to lower the excitation of the nerves. And then you've seen many ads on television, I'm sure, for a variety of different things for fibromyalgia, et cetera, et cetera. Well, let's ask ourselves a simple question. What if it's exactly the opposite? What if RSD, fibromyalgia, et cetera, is not an over-excitation of the nerve, but it's an under-excitation of the nerve? And if that's the case, and we're all treating it as over-excitation to lower it, in essence, I believe that we're compounding the problem. And again, this is strictly my opinion after dealing with hundreds of cases. One of the things that we found very effective with RSD, and again, the only way you're going to ever know is if we can help you with the ARP Wave system is to try it. We can talk on the radio, we can be on TV, we can be face-to-face with you, and we can talk until we're blue in the face, but until you actually experience a therapeutic session, you or I are not going to know if it's going to be efficient for you or not. So that's why we are setting up this provider network all throughout South Florida to give you, the patient, the opportunity to go into your local doctor, your local provider, and actually experience at no cost an ARP Wave session, because then and only then will you know if this system can help you. So getting back to what we've been successful in doing with RSD is the very first thing we do is we follow the system. And as we said earlier today, the very first step of the system is find out, is the nervous system sending the right signal to the muscles to allow them to act as shock absorbers? And in every single case I've ever seen, the answer to that question or the end result of that test was no. The system was not operating efficiently. So the second thing we have to do is, and again, following the system, is we have to identify, if we can, where that signal is coming from causing the pain. And we go through a simple process that we call cellular disruption location, and we identify that signal. Once we identify that signal, an amazing thing happens with most CRPS and most fibromyalgia patients, and that is they no longer have pain. Now, the brain can only think about one thing at a time, so with a light stimulus of energy going into the body, the brain can only concentrate on one stimuli at a time. It chooses to concentrate on the stimulus we're sending in rather than the pain stimulus. Henceforth, we don't have pain. So once we began treating these patients, we treated them with very, very, very low tolerances of very light electrical current, barely perceptible to the patient, and an amazing thing happens. Almost all of them, and when I say almost all, I'm talking about 95% of them, experienced results that were extremely satisfactory and changed their quality of life, and more importantly, reduced their need for medication to address the quality of life problem of their pain. So, in our opinion, the only way to know if we're going to be able to help you is go to one of our providers, go through a session. It takes about 30 to 40 minutes for your first session. There is no cost to you. It's covered by insurance. And so find out for yourself, can we help you or not? Don't let somebody tell you we can or we can't. The only way you're ever going to know is to try it. And the only way to try it without any cost is go to one of our providers. So I strongly, strongly suggest anyone who's in pain listening to this show today, please contact your local provider. Contact us at painmanagementnetwork.com, and we'll supply you with a provider in your area where you can see for yourself if we're able to help you with the ARP Wave System or not. It's not a panacea. It's not going to help everybody, but I guarantee it's going to help about 95% of the people listening today, which is not a bad number. So to answer the question to the emailer here, yes, I do believe that we can make a facilitated change in the symptoms. Will it cure the disease? Absolutely not. There's nothing that will cure any type of disease for the most part. Typically, a disease is a disease. We do not work on disease. We are not doctors. We do not diagnose. Basically, all we're saying is go to our provider, check it out for yourself, because that's the only way you're going to know if we can give you a quality of life that you are not experiencing right now. So I have another question here that you might be interested in listening to the answer. Emailer sends in your opinion, why do we have so many repetitive task injuries such as carpal tunnel? Well, the answer to that question, I believe, is that carpal tunnel, again, you remember when we began the show today, we said wherever you have pain is where the problem ended up, not where it's coming from. So think about carpal tunnel. Where's the pain ending up? It's ending up in the wrist. Why is it ending up in the wrist? What muscles aren't working correctly? Well, the muscles in the forearm or the shoulder aren't working correctly, because if they were, the force wouldn't be going to the wrist. So if you look at things simplistically like that, it starts to make a little bit more sense why we have so many joint problems and why we don't really satisfy those joint problems. We medicate them, we kind of hide them for a while, but we don't really get rid of them. And why can't we get rid of them? Because we're only working on where the problem ended, not where the problem is coming from. So in a carpal tunnel situation, as an example, following the system, we first off find out step one, is the nervous system sending the right signal to the muscles to allow them to do what they're supposed to do? And in most cases, it is not. So we then have to turn back the nervous system. We have to turn it back on. And the way we do that is a very simplistic technique that we've created within the ARP Wave System, utilizing our proprietary technology to basically re-stimulate the nervous system and send the proper signal to the muscles to allow them to do what they're supposed to do. Once we've done that, now we got to go in and we have to fix all the damage caused by the muscles not doing what they're supposed to do. So we do that in step two of the system. And we search, we look for the cellular disruption, we find the cellular disruption, we identify where the electrical short is, and once we know where the electrical short is, we can basically change the electrical short. So last week we talked about an analogy of us being a television set. Well, if you have a short in the TV doesn't work. And if you don't address the short in the TV, your TV is not going to work. We'll be back in just a moment and continue on. Thank you.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website www.painmanagementnetwork.com and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com, and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
Well, we're back, and when we left, we were talking about, again, a simple analogy, and that analogy is if you were a television set and you have a short in your TV, does it work? And, of course, the answer is no, it doesn't. And it doesn't make any difference where the short is, it still does not work until you fix the short in the television. Well, the human body is exactly the same way. And the ARP Wave System is addressing where that short is and correcting that short. In simplistic terms, we're like an electrician fixing an electrical short. We're working strictly on the electrical component or the neurological component of the injury or of the pain. And once we know where that short is, quickly the system will erase it and correct it and get the system working the way it's supposed to work. Another question that came in from last week's show is, in your opinion, why do we have so many post-surgical problems? And I think what I'm in reading this email from this emailer, they have gone through surgery. They had a total joint replaced, a total knee replaced. They were told that that was the problem, and they're right. They were bone on bone, so they obviously had to have that surgery. And we can talk about that, in the later shows. Did he or did he not really need the surgery? But we're addressing the fact right now that this individual had the surgery. And now we're probably, I think he says here, he's 7 months post-surgery, would like to play golf but can't, still has pain, cannot get much lower than 90 degrees, hurts when he sits in a chair, not as much as it did prior to the surgery, but he still has symptoms. And the question is, what can the ARP Wave System do for him? Well, the answer is this. Again, the reason we had surgery is because we had tissue that was damaged, and the reason we had tissue that was damaged is because the muscles in the legs didn't do what they're supposed to do. So think of the muscles in the legs as shock absorbers, and now the shock absorbers aren't working. So all the shock is going to go to the knee joint, and sooner or later, it's going to wipe out everything in between the knee joint, all the fluid, all the cartilage, and sooner or later, you're going to be bone on bone, just like in a car. You take the shocks off a car, all the force goes to the frame of the car, sooner or later, you're going to have problems. the body's exactly the same way. Again, a simple analogy. So what can the ARP Wave system do? Well, first off, I firmly believe, and the only way you're going to know if we can do what I say we can do is go to one of our providers. But I believe that we can get this individual completely out of pain. I believe we can get them into a full range of motion, and I believe we can get them playing golf in a very short period of time. Now, the way I know that is we've treated over 75,000 patients all over the world with similar problems. And again, following the system. The first step in the system is find out, is the nervous system working correctly to allow the muscles to absorb force? Well, if you had surgery, I can categorically tell you your muscles are not working neurologically, or you would not have had to have surgery. Just that simple. So the first thing we got to do is we got to turn the nervous system back on. Once we do that, it's like plugging in a computer. If a computer's unplugged, it doesn't work. If you plug it in, it works. So we got to plug in the nervous system. We got to start up the nervous system. Now, stop and think about this. When you have surgery, you're cutting into an electrical wire. That electrical wire is your nervous system, your nerves that drive. So your muscles are driven by an electrical current. Once you cut into electrical current, it disrupts the electrical current. Now, and again, a simple analogy. If I take an electrical cord attached to your television set, turn off the TV, unplug the cord, and cut the cord in half, and then try to plug it back in, it is not going to work. Well, that, I believe, is one of the hidden problems with surgery, is there is an electrical component, a neurological component to the surgical intervention. And until such time as the nervous system basically has been reset and the muscles neurologically are firing again, you are going to have exactly the same problem you had prior to the surgery, just not with as many symptoms. But you have the same problem. The force is not going into the muscle. Actually, the surgery has disrupted it even more than the original problem, so because surgery is trauma. Well, what caused the problem to begin with was some form of trauma, so now you have double trauma, and you have these muscles not doing what they're supposed to do, so the force then has to go to some place, and it is going to go into the joint, and it's going to hurt when it goes there. So imagine how simple it would be as if all we had to do is transfer the force out of the joint back into the muscle. Henceforth, you would have no pain. And that's exactly what this emailer would see if he goes to one of our providers. One of our providers will go through the system, and by the time they get into the treatment side of the system, I can almost guarantee you this patient is going to be pain-free. Why? Because we've transferred the force from the area where the force has been going to an area where it's supposed to go. And the second that happens, you no longer have pain. It's just that simple, folks. But again, it sounds way too good to be true. Why do you think that we're offering you the opportunity to go to a local doctor in your area that we recommend, who's one of our providers? And trust me, as we're on this radio show, we're reaching out to doctors throughout all of South Florida, explaining to them that we're going to have literally hundreds and hundreds of patients that we're going to need to find a home for, and we'd like it to be them. So if your doctor does not presently offer the ARP Wave system, I would strongly suggest you contact them and have them contact us so we can give you this evaluation and treatment at no cost in that doctor's office where you feel comfortable because it's your doctor, and you will see for yourself exactly what I'm saying is true. When force is going to a joint, it is going to hurt. When force is taken out of the joint, there is no more pain. It's just that simple, folks. So in answer to the emailer, yes, I do believe that we can dramatically help him, because what we would do is transfer the force from the area that it's going to and get it to go to the muscles where it's supposed to go. That's number one. Number two, we're going to get blood supply to the area that had surgery on it. That's going to speed up the healing process. And number three, we're going to neurologically retrain this individual on how to move efficiently. And the way we do that is in the ARP Wave treatment side, or step 2 of the ARP Wave system. Remember, it's a 3-part system. Step 1, find out, is the nervous system working? If it isn't, get it working. Step 2, correct all the damage caused by it not working. Step 3, improve the body's ability to absorb force consistently. That's the 3-part system. So in answer to the emailer, and hopefully you're on the radio today, in answer, yes, I do believe that we can help you. I do believe we can get you out playing golf very, very quickly, and I do believe that we can change your movement pattern. Because without even seeing you, I can tell you how you get out of a chair. You get out of a chair. If I'm looking at the email here correctly, it's your right knee. So I guarantee you, when you're getting out of a chair, you're planting your left foot and you're taking most of the load off your right knee. You're leaning forward, you're using your hands to push off, and you walk with a limp. You don't walk, you shuffle. And since you're doing all those things, all you're doing is reinforcing the fact that you have a neurological problem. You're going to change all that pattern. That's what the ARP Wave system does. It neurologically retrains you on how to move efficiently. It neurologically stimulates the muscles to where they absorb force. And more important than all of that, it fixes all the damage caused by the muscles not doing what they were supposed to do to begin with. So as you can see, if you have questions, we'd be more than happy to answer them. I've got about 25, 30 more questions here that we could answer. So we're going to be running out of time here in the not-too-distant future. So we're not going to get to all of these questions today. But if you've got a question that you'd like answered on the show next week, just contact us at painmanagementnetwork.com.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website, www.painmanagementnetwork.com, and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave system to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com, and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
We are back. So It's been a very interesting day so far with the questions that we've received via email, and we have lots more coming in. Just looking at this list here, it's quite extensive. One of the other questions that I'm constantly asked is, what is the difference between the ARP Wave System and physical therapy? And let me see if I can answer that here on this last segment of the show. Physical therapy is an extremely effective means of therapy. But physical therapy is just that. It's addressing the physical side of the therapeutic equation. It is not addressing the neurological origin of the symptoms. And physical therapists are extremely intelligent. They go to school for a long time. They're very gifted at what they do. The difference is they are not trained in the neurology of the injury, and not too many people are. So the ARP Wave system basically is creating literally a brand new branch of therapy that we call neurotherapy, not physical therapy, neurotherapy. So the difference would be this. Let's say that you have a fractured arm, and you go to your doctor, and the x-rays indicate that you've broken your arm. So generally speaking, you're going to be put into a cast. You're going to be wearing this cast for about 6 weeks. You're going to be in a sling, and your arm is going to be about a 90-degree angle inside the sling. And you're going to be wearing this for basically 6 weeks. So during the period of time that you're in the cast, basically the bone is going to be healing. You're basically not getting a lot of blood supply to that area. So it takes about 6 weeks normally for that tissue to heal. So let's say now at the end of 6 weeks, you take your arm out of the cast and you're still at a 90-degree bend in your elbow. Are you going to straighten out your arm? And of course, the answer is no. As a matter of fact, you don't even have to have a broken arm. You just put your arm in a sling for 6 weeks. Don't move it. Keep it at a 90-degree angle, close to your chest, and I guarantee you're not going to straighten out your arm at the end of 6 weeks. Why? Well, because there's a neurological signal now that says this is where my arm is supposed to be. That's called homeostasis. And since that is a neurological signal, every single time you attempt to straighten out that arm, you're reinforcing that protection mechanism, and the muscles are going to go to what's called concentric contraction, and they're immediately going to tighten up. So a physical therapist, with all their skills, are still going to have a hard time getting your arm straight in a short period of time. So it might take a number of sessions to get your arm straight, and every single time they apply pressure to your arm to get it to straighten out, it's uncomfortable, number one. Number two, it's difficult. And number three, it is going to take a considerable period of time. And the answer to the question is, what's the difference between the ARP Wave system and physical therapy? And the answer is this. What we do, instead of working against the signal, we change the signal. So example, the muscles that are supposed to straighten out your arm and take it into extension are not getting the proper signal. And the reason they're not getting the proper signal is because the proper signal they're getting is to be in concentric contraction and hold the arm in this position because it's been there for 6 weeks. What we would do with the ARP Wave system is go through the entire process, find out if the nervous system is working correctly, get the nervous system working, and then we would apply an electrode directly to the muscle that should be getting the signal to do its task of straightening out your arm. And what we would do is we'd put an electrode on your tricep, and another electrode strategically located, And we turn the power up very slowly, and guess what's going to happen to your arm? It's going to immediately straighten out. Why? Because in 1/16th of a second, we change the signal. So let's say it normally would take, let's say 3 or 4 sessions of physical therapy to get your arm straight, and you're fighting that signal. Or you can stay on 1/16th of a second and get it straight and not have to fight the signal. That's the difference between the ARP Wave System and neurotherapy and physical therapy. They're both extremely effective, but one addresses the physical side of the problem and fights the electrical signal, and the other addresses the electrical side of the problem and changes the signal. So we're not fighting a signal, we're changing the signal. That is what neurotherapy is all about. So for the providers listening to this today, it's very, very clear, or should be very, very clear to you, that we're reaching out to patients all over South Florida. We're looking for doctors who will administer our services. And for the doctors, we're not asking the doctor to administer the service. We're going to train someone in the doctor's staff to do this service. So the doctor does what the doctor does, and their staff does neurotherapy or the ARP Wave system. Our company, my staff, will train the doctor's staff in our system. For right now, if you're a patient and you're looking for a doctor, give us a contact. Call us. You can call us locally at 954-256-0045 or on the web at painmanagementnetwork.com. Find out if we have a provider in your area. More than likely we do. If not, I strongly suggest you invite your doctor to become one of our providers, because only then are you going to know if the ARP Wave system can help you. So the system is very, very simple. It's very complex, and I know that sounds like an anomaly, but it isn't. It is simple because it works on simple premises. The simple premise it works on is all pain, all injury is a direct result of the nervous system not sending the right signal to the body to allow the body to do what it is supposed to do. If you change that signal, the body will do what it is supposed to do. Now, if we're breaking down a pattern, the only way to break a pattern, many of you in pain right now have a pattern. Look around. When you get out of a chair, how do you get out of a chair? When you walk, do you walk with a limp? When you raise your arm, do you raise your arm straight up? Or is there a bend in your arm? Or do you lift it with your shoulder? Those are all compensation patterns. When you're standing, do you stand with your feet straight ahead? Or do you stand with your feet cocked off to the side? Do you stand leaning to the right? Do you stand leaning to the left? What do you do? Because I guarantee you, if you're past the age of 4 years old, you've got a compensation pattern. That pattern is a neurological pattern. No amount of physical exercise, no amount of physical therapy, no amount of any type of manual work is going to change that pattern. The only way you're going to change that pattern is to neurologically reestablish a new pattern. And that exactly is what the ARP Wave system does. We change patterns. We change not only the quality of your life, but we change the pattern which is taking away from the quality of your life. So providers, what we do is we neurologically re-educate every single patient on how to move efficiently and how to absorb force and how to take force out of damaged tissue while we're increasing blood supply. It should be relatively simple to understand that what we're doing basically is changing the neurological information going to the muscle to allow the muscles to do what they're supposed to do. Now, once the muscle knows what it's supposed to do, it has to be told how to do it correctly, because you've been doing it incorrectly for many, many years. Many times I'll see a patient who's been diagnosed with adhesive capsulitis, frozen shoulder, can't get their arm off their side. All that's happening is the muscles are in a protected state. They're getting a neurological signal to protect. All we have to do is change that signal and allow the muscle to go to eccentric contraction. In other words, lengthen. And when that happens, the arm is going to raise up very efficiently, and there's going to be very, very little pain. Why? Because we've shifted the force from a muscle not able to absorb the force to muscles that are now able to absorb force. Well, we're at the end of this week's show. Again, to get any question on next week's show, contact us at painmanagementnetwork.com or call locally here at 954-256-0045. And until next Monday, have a great week.
You've been listening to Pain Free Today with your host, Denis Thompson. Denis is the creator of the ARP Wave System. Send in your questions for next week's show to questions@painmanagementnetwork.com. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.